Hi, everybody. I'm Jennifer Doliak, a senior fellow at the Niskanen Center and economics professor at Texas A&M University. Welcome to the fifth and final webinar in our 5-part series on how to reduce violent crime. Each hour-long webinar consists of 5 short presentations of research by leading scholars in this space with an emphasis on policy takeaways. We know that many are concerned about rising rates of shootings and homicides in many US cities right now, and hope that this research provides useful guidance for communities that are wondering what they can do to improve public safety and save lives. We do have one slight change to the schedule today. Jacob Vogler had a family emergency, so isn't able to attend and present his work today. Hopefully we can get him to do a short presentation for the Niskanen Center website later. We'll keep you posted on that. And of course, if you missed any of the first 4 webinars, you can find the recordings on the Niskanen Center website. We will start things off today with Elisa Hakame. You have 10 minutes and the floor is yours.
Okay, thank you so much, Jen, and thank you so much for organizing this conference and inviting me to speak. I'm going to share my screen here. Give me 1 second. Can you all see that?
Yes.
Okay, wonderful. So I'll be presenting to you this paper, Mental Health and Criminal Involvement, Evidence from Losing Medicaid Eligibility. And the motivation behind this paper is the high prevalence of mental illness in today's criminal justice population. So to illustrate this prevalence, I'm just showing you here a figure that I made with my primary data source. I'll tell you a bit more about the data later on, but I simply want to show you the likelihood of incarceration for individuals with and without mental health histories at a given age. So here the blue line shows you the likelihood of incarceration for individuals who received a mental health diagnosis prior to age 17. And the orange line shows you the same probability for those that never received a diagnosis. So you see that by age 24, individuals with mental illness, diagnosed mental illness, they're 3 times more likely to have been incarcerated than those without a diagnosis. And this very strong correlation between mental illness and criminal involvement is not just present in my data, but it's well established in other data sources as well. And from a public finance perspective, individuals with mental illness tend to have longer prison sentences, higher recidivism rates, and more expensive medical needs. So they're a very high cost population within an already expensive criminal justice system. So this correlation begs the question of whether it will tend to persist, whether this high correlation will always happen, or whether improving access to health services could potentially be one way to reduce these individuals' contact with the criminal justice system. And that's exactly what I study in this paper. The way that I go about studying this question is by using administrative data from South Carolina that links individual level records across a number of government agencies. And importantly, this data is going to include information on both health and crime-related outcomes. And so I have access to Medicaid claims data that allow me to identify individuals with diagnosed mental illness. And I also have data from law enforcement agencies that helps me measure any contact that these men have with the criminal justice system. And so I'll go into the research design a little more, but what you should have in mind is that the way that I will study this question is by leveraging a break in Medicaid coverage that happens when individuals age out of Medicaid eligibility when they turn 19. And I do want to point out very briefly that Medicaid is a very relevant policy to think about in this context, not only because it's the provider of healthcare for most low-income Americans, but it is also the largest payer of behavioral health services in the US. And so in terms of thinking about access to mental health care, Medicaid is a very important policy. So now let me give you a little bit of background about the data. Let me just start off by just talking about why it might be the case that losing access to insurance might affect criminal behavior. And so I don't want to spend too much time on this, but I just basically want to talk about the fact that losing access to Medicaid means losing access to services. And so that can just have a wide array of effects on the individuals that were relying on Medicaid for these services, whether that's medication or access to, for example, social workers, or any of the other services that Medicaid provides. And so I've included here a number of things, a number of channels that might be underlying this relationship. And so one example is that if individuals are relying on Medicaid for access to medications or other resources, and they lose access to these services, then that might disrupt their educational attainment. That might make it more difficult to find or to keep a job, and that might make criminal activities more appealing. So that's just something that you can have in the back of your head as we talk about this relationship between Medicaid coverage and criminal involvement. The data, to give you a little bit more of a sense of what it's going to have and the data that I use, It's going to be data for a disproportionately low income sample of adolescents in South Carolina. And for those of you that are less familiar with the state, it's a relatively low income state with low levels of health insurance coverage. And the data that I have is going to include these insurance claims, as I mentioned, which allow me to see all visits to doctors and hospitals, as well as all pharmacy claims, as well as all these criminal outcomes from 3 different law enforcement agencies that are going to allow me to see information on all arrests, incarceration spells, and so on. And as I mentioned, it's going to be a disproportionately low-income sample of adolescents, and I've included some statistics here to give you a sense of the data that I work with. So these individuals are relatively low income. 3/4 of them have at some point been enrolled in Medicaid, and criminal contact with the criminal justice system is relatively high, even in adolescence. I also want to give you a brief sense that within the sample that I'm looking at, there is a high prevalence of mental disorders that I can see through the Medicaid claims data. So I've included here some of the most common diagnoses that I see. You see that the most common one is hyperkinetic syndrome, otherwise known as ADHD, but we also see a sizable share of these individuals with other disorders. And I'm also able to see what kinds of services these individuals are using, whether that's meetings with social workers or counselors or mental health medications. So to give you a sense of what I do to study this question, I'm going to use the fact that individuals have access to coverage, Medicaid coverage between the ages of 0 to 18, but then they age out of this eligibility when they turn 19. And so there are some exceptions for individuals who are allowed to stay on past 19, but for the most part, childless adults in South Carolina and in many other states in the South have very limited access to Medicaid services past 19. And so the spirit of the analysis is that I'm going to look at individuals who were enrolled in Medicaid right before 19 and who lose access to this coverage. And I'm going to compare them to individuals that were not enrolled right before 19, but who resemble these other individuals along other observable characteristics. And so I'm going to compare their likelihood of incarceration before and after 19 to see whether those that were affected by this loss in coverage seem to be more likely to be arrested and incarcerated after losing access to insurance. So I've included here a few more details, but for the sake of time, I won't go too much into it, but I basically assign individuals to these treatment and comparison groups, and then just look at their outcomes before and after 19. So as I said, I'll assign them a little bit earlier so that I can study whether the 2 groups look similar in the pre-period in this moment of time before 19. And then if I see any divergence in outcomes that starts right at age 19, then I can attribute that difference to the loss in Medicaid eligibility. Okay, so here I'm showing you some of the results. On the left-hand side, I'm just plotting the raw data, the raw means of the data. And on the right-hand side, I'm showing you this difference in differences that I mentioned, looking at the differences between the 2 groups before and after 19. And so we see that the 2 groups look relatively similar before 19, but then they begin to diverge from each other so that the individuals who lost access to Medicaid are more likely to be incarcerated after 19. And if I look at whether an individual has ever been incarcerated, I find a similar result, and I see that this increase is coming from new individuals being incarcerated for the first time, so having their first serious criminal justice contact after losing Medicaid eligibility. And so the question here is this all about just losing Medicaid, or is it perhaps specific to losing access to Medicaid's behavioral health services? And so what I do next is I look specifically within these 2 groups at individuals with and without mental health histories to see whether the effect is being driven by one of the 2 groups. And when I do that, and you can look here at the right-hand side, I find that individuals who lost Medicaid coverage but did not have a mental health history, they continue to look exactly like their comparison group after age 19, whereas the individuals who had mental health histories, they're completely driving the effect. This increase in incarceration that I see is entirely driven by these individuals. I also wanted to show you that when I look specifically at violent offenses, this is one of the category of offenses that does seem to increase when these individuals lose access to these services. And then finally, the last result I want to show you is, well, I've shown you that individuals with mental health histories seem to be more likely to be incarcerated after losing access to insurance, but is it something about losing access to medications, for example? What is it about these behavioral health services? And so if I focus only on individuals who were relying on Medicaid for mental health medications, I find that the effect is more pronounced for these individuals denoted here in purple. And so it seems to be the case that individuals rely heavily on Medicaid for these medications, and losing access to these medications is quite important. And I do see that this increase in violent crime specifically is also more pronounced for individuals relying on medications. So just to summarize what I've shown you, since I'm running out of time, in this paper, I look at the impact of losing Medicaid eligibility on low-income men's likelihood of incarceration. And I find that men with mental health histories who lose access to Medicaid, they're more likely to be incarcerated, and that the effects are more pronounced for those relying on Medicaid for medications. In the paper, I also do a cost-benefit analysis, thinking about Medicaid eligibility as a policy and how it compares to other policies. And I find that it's a relatively cost-effective policy. For every dollar spent on Medicaid, society recoups around $2 in associated benefits. So to conclude, just thinking about what the takeaways and the policy implications of this paper are, one natural implication is that policymakers might consider improving access to mental health care as one way to reduce crime and also lower criminal justice expenditures. And to the extent that mental health care might complement other policies that are already in place, for example, some more traditional policies like hiring police officers or longer sentence lengths, to the extent that individuals are more able to reduce errors in judgment or decision-making when they have access to mental health care, then we might even see mental health care as a complementary policy as opposed to a substitute for other policies. Finally, if expanding Medicaid is not feasible, then I did want to mention that there are other policy alternatives that are sort of natural implications of this research. One potential alternative is expanding coverage just for individuals with mental health diagnoses or that are using behavioral health services, or perhaps even having limited benefit programs that don't have full insurance coverage, but only cover behavioral health services. And then finally, for states that have already expanded Medicaid, other alternatives include ensuring that there are sufficient providers of mental health services. In certain areas, this might not be the case. And so making sure that adults and low-income young adults have access to these services seems to be quite important given the findings here. And then finally, and I'll just conclude by saying that, of course, I've studied Medicaid here as one very relevant policy to consider, but of course, providing access to affordable behavioral health services through alternative agencies or means is also another implication to take away. So I'll pause here. Thank you so much.
Excellent. Thank you, Lisa. And next up is Kevin Schnepel.
Great. Thanks, Jen. Let me share the right screen here. So thanks everyone for coming. This is my second appearance on this excellent webinar, so I feel honored. I'm going to be talking about another one of my papers, not the one I talked about a month ago, that we think also has, something we can learn something about violence and the determinants of violent crime. Just to motivate, I think, if we think about this question about reducing violence, a lot of times we might hear a case made against leniency, in the sense that being more lenient is often thought of as being associated with increases in violent crime or potential increases in violence. You can think back to the Willie Horton story back in the 80s and that type of fear, I guess, of letting people out early or being too lenient and experiencing some horrific violence as a result of that. Just from some recent, Google news headlines, I think this is also part of the rhetoric today, in the sense that a lot of this increase in violence is being correlated or linked to potential increases in leniency. So I think our study is going to help it potentially dispel this myth for a certain type of offenders. The general trend, I think, in the US, and it's quite clear over the past few decades, has been towards more leniency, especially for first-time and low-risk defendants. And again, these increases in leniency are often met with fears of increases in violence, as you can see from these headlines, but there's not much empirical evidence supporting this. So what do we do? This is a paper with Mike Mueller-Smith at the University of Michigan, and it recently published in the Review of Economic Studies. And so what we're looking at here is a second chance for first-time felony defendants in Harris County, which is the county that holds Houston, in Texas, and we're looking at a practice that's part of a kind of a suite of what you hear discussed as diversion programs in the criminal justice world. And so what diversion is broadly is a practice where, and it can be at very different stages and different levels. So it's a practice where a police officer, prosecutor, or judge provides an opportunity for an individual charged with a criminal offense to avoid a conviction either through a dismissal, so a case dismissal, or the charge is dropped, or the felony is not, the conviction is not upheld through some alternative measure. And so our setting and our analysis is Harris County, Texas. And in this setting, around 60%, so more than half of first-time felony defendants going through the Harris County court system are diverted at the court level. And this is most often through a deferred adjudication. And I'll talk a little bit about what that is. And then there are also some case dismissals. And one thing I want to point out is a lot of the motivation behind these diversion programs is, of course, the idea that the second chance might have benefits for the individuals receiving the second chance, but also a lot of it is just managing, extremely high caseload levels within these courts. And so kind of a triage type strategy to help deal with a lot of cases coming through these courts. So deferred adjudication in Texas, just to give you a bit of detail, I won't go into too much detail. A lot of it's in the paper. This is essentially an agreement where the defendant admits guilt to the offense and then goes under a mandatory community supervision period, typically around 3 years. And if that period is successfully completed without a further violation or criminal incident, then that initial felony conviction for which they were facing a charge never gets tagged to their record. And so they get a second chance to avoid that felony conviction through this deferred adjudication program. And so the baseline result, and I'll show you this in a few ways, is that we find that providing an opportunity for these defendants to avoid a felony conviction has a very dramatic effect on reducing reoffending rates among those receiving the second chance, and also boosting employment rates by nearly 50% over a 10-year follow-up period. And so I'll illustrate some of these results, but these are enormous effects in terms of the future offending and employment outcomes we see amongst these individuals. And I won't get into the details of the data linkage process, but this is linking court records with administrative employment records from the Texas Unemployment Insurance System. Okay, so how do we measure the causal impacts of a second chance? And so, of course, a lot of these diversion programs, there's a lot of discretion involved that both amongst the defendants as well as the individuals offering these options. And so identifying a causal effect of these programs is quite difficult. What we do is we look at two very dramatic shifts in the use of the diversion. In this setting, most of this is deferred adjudication changes, one in 1994 and one in 2007. And so these are illustrated by these pictures where these dots represent the average rate of diversion for cases coming to the Harris County Court based on the date of the court appearance. And so here we see that over 60% of these first-time, this is a sample of first-time felony defendants, over 60% are receiving diversion. And then there's a very dramatic 24 percentage point decline in deferred adjudications or diversion in 94 at September 1st, 94. And then in 2007, we see this very dramatic reversal for a completely different reason based on the November 7th, 2007 date. And so just a very quick sentence about each of these changes. There's a lot of nuance behind these changes, but the 94 change was caused by a reform to the Texas Penal Code that changed the attractiveness of the deferred adjudication option for prosecutors. And so that led to this really dramatic decrease in the use of this diversion program. And then in 2007, this increase was following a somewhat unexpected defeat of a jail expansion ballot initiative in Harris County. In the next week, the judges were treating these types of defendants very differently in terms of their use of the deferrals as well as the case dismissals. And so what do we find? Essentially, what we're going to do is compare these defendants that are coming in just before these changes to those charged with the exact same types of crimes, very similar in characteristics, coming through that happen to come through the week after these major changes or the months after. And so that comparison of that before group versus that after group gives us an idea of the causal effect of this program. And overall, we find, as I mentioned, we find very large declines in future offending with diversion. To highlight, what I think everyone's here today to hear about in terms of the violent effects. We don't find the biggest treatment effects on future violent crime, but importantly, we don't find any increases in future violent offending associated with the second chance. So I think that's it's evidence that suggests that being more lenient in this case, at least, did not lead to these really concerning increases in violence down the road. Just to highlight some of the striking employment effects we see, this is in the 1994 experiment where we can follow these defendants for up to 20 years. Afterwards, 20 years after the treatment, so the diversion, that group that got diverted because they just happened to come in, I guess in 94, it was before the change versus the group just after. 20 years later, we see about 4 full years of employment difference between that group that came in just before and got diverted versus the group that came in after that's similar or identical in observable characteristics. And the analysis of other labor market outcomes suggests this diversion is enabling individuals to find better and more stable jobs when we drill down into the details in the administrative earnings and employment data. And so policy takeaways, I think our study is part of the increasing evidence. You saw one last week, I believe, Amanda Egan and Jen Doliak and Anna Harvey's paper on misdemeanor prosecution. So part of the increasing evidence that stigma, well, I guess that these increases in violence may not result from this increase in leniency, but also part of increasing evidence that stigma associated with a felony conviction plays a key role in depressed labor market outcomes that we see amongst individuals with criminal histories and high rates of recidivism. And so we do a lot in the paper to try to, evaluate whether the stigma of a felony conviction is an important driver, including looking at the effect of diversion for the non-first time felony defendants and not finding huge benefits, but also not finding big increases in criminal offending amongst that group as well. And so I think this, points to the idea that these increases in violence, these fears may not be one of the costs associated with increased leniency. But a big caveat here is, of course, our results are based on increased leniency for first-time felony defendants who are mostly facing charges for property or drug crimes in Harris County, Texas. And this is not because we limited it just to these defendants, it's because these changes were mostly targeted or directed towards, or these programs are mostly targeted and directed towards the non-violent offenders. That said, we do have some defendants in that second change in 2007 where the judges just came in and started diverting more individuals after that failed jail expansion ballot initiative. And it's a smaller sample, and so we're limited by sample size, but we do not find that the diversion, the increase in diversion or increase in leniency for violent defendants facing violent felony charges increased the offending in any way. If anything, it decreased the future offending for that group as well. But again, we're limited a bit in sample size there. And so most of these results are, does this treatment increase violence amongst those individuals facing those property or drug felony charges? And so I will stop there and thank you all for your attention.
Thank you, Kevin. Gaurav Khanna, you are up next.
Thank you, Jen. This is joint work with Carlos, Anant, and Jorge, and together we started this research agenda really trying to understand why youth in Colombia actually get involved with criminal enterprises like gangs and cartels and militias. And the way we kind of approach this problem is trying to understand how joining these criminal enterprises might actually be kind of an occupational choice, kind of like a career decision in different nodes of your life. But to kind of really study this kind of theory, it's quite challenging because you need some really good individual level variation, essentially exogenous variation in the incentives to participate in these criminal enterprises, right? And you need some really good individual level administrative records, like the type you see from, looks like Harris County, Texas, and Northern Europe has some really good examples of this really good administrative records. So what we've been doing over the last half decade is linking individuals using their social security numbers across different administrative databases in the very high crime setting of Medellin, Colombia, which, as many of you know, is one of the most kind of violent cities in the world. It has a tragic history of cartels and militias and paramilitary groups. Even once homicide rates had fallen, it was still the 10th most violent city in the world, right? So the paper that I want to talk to you about today is really setting a somewhat specific policy where essentially there's a policy that increased benefits for individuals as long as they were not in the formal sector. So they targeted this policy to low-income individuals as long as they were, as long as they dropped out of the formal sector. Now, this kind of policy essentially led to a decrease in formal sector employment. Individuals dropped out of the formal sector to kind of get these benefits. I'll talk a little bit more in detail about what these benefits are, to get these benefits. And where we come in is saying that, well, if these youth don't join the formal sector, are they then more likely to start joining criminal enterprises and get involved with crime? So the specific question we're trying to answer is how these disincentives for formal sector employment actually induce these criminal careers. And we're going to try and distinguish the types of crimes that these individuals end up getting involved with, especially trying to distinguish between occupational-based crimes, like the types you see with criminal enterprises, or crimes of impulse and passion, like domestic violence and rape. What we essentially find in this paper is that as a result of this kind of disincentive for being in the formal sector employment fell, and there was an increase in arrests for these enterprise-related crimes, but there was not really a change in these crimes of impulse or passion. So what is the policy that I'm talking about? So most Colombians are essentially covered by two benefit regimes. If you're formally employed or if you're high income, you essentially pay a substantial fraction of your wages into what we call the contributive regime. Which then is used to cross-subsidize the low-income non-formal workers and the low-income non-formal households who benefit from the free subsidized regime, right? But to get the free subsidized regime, you have to not be formally employed. So what this does is it kind of creates this disincentive. It discourages formal sector employment. The government themselves recognize that it actually discourages formal sector employment. And there's actually a lot of academic literature showing how this informality clause lowered formal sector employment. So how is this policy targeted? And that's where kind of our research design becomes quite important. Everyone in Colombia gets what we call a poverty score or CISBEN score. If your poverty score is above a cutoff, you actually become eligible for what we call the subsidized regime, right? So think of it as, me and my neighbor are almost identical in many respects. It's just that maybe my neighbor has an extra radio at home which means that I have a slightly higher poverty score than my neighbor, I am now eligible for the subsidized regime as long as I drop out of the formal sector, right? So what you see at this poverty score cutoff is this jump in enrollment in the subsidized regime. And so for our research design, essentially what we're going to do is we're going to compare households on this side of the cutoff to this side of the cutoff, because they're almost identical households, right? Me and my neighbor are very similar. It's just that, you know, on one side of the cutoff, you're eligible for these free benefits as long as you drop out of the formal sector. So I'm going to zoom in around this cutoff and really try and understand what happens to individuals that might drop out of the formal sector to individuals that are not incentivized to drop out of the formal sector. Well, what you first see is, you know, zooming in around that cutoff is that formal sector employment fell. So individuals with a slightly higher poverty score dropped out of the formal sector with the hope of, you know, benefiting from the free benefits regime. But this has been shown by other researchers. Where we come in is we try to understand, if youth drop out of the formal sector, do they get involved with criminal enterprises? Now, crime in Medellin has a very distinct flavor where criminal enterprises are really quite prevalent. There's hundreds of street gangs in different neighborhoods, which essentially function like these kind of profit-seeking organizations. Gang leaders are actually quite well off. And if you really read interviews of gang members, they really talk about it kind of like as a career choice. They join these gangs for a profitable career. Gangs are actually recruiting individuals, offering them kind of these job options, saying, are you going to work with us? Are you going to do a different type of job, right? But if these individuals are getting involved in this kind of criminal enterprises, what we should see is that there should be a change at that cutoff. There should be a change in enterprise-based criminal activity rather than any kind of change in, say, domestic violence or any other kinds of crimes of impulse or passion, right? So to do that, to understand, you know, to make this distinction, we need to go to our data and classify the crimes as those that are likely to be associated with criminal enterprises and other types of crimes, right? The way we do that is that in our data, the police actually flag, if they suspect the person arrested to be a part of a gang, they actually flag which gang they think they're a part of. So what we can do in our data is actually look at what crimes gang members are more likely to be involved in. So for instance, we can then say that a crime like homicide is more likely to be associated with criminal enterprises, whereas a crime like rape or sexual assault, according to our data, doesn't seem to be associated with criminal enterprises, right? So we can make this distinction and then study outcomes for these different types of crimes. So when you look at, say, enterprise-based violent crime, and, you know, again, zooming in on that cutoff, what you see is that, you know, remember, individuals on this side of the cutoff dropped out of the formal sector, they are more likely to get involved in enterprise-related violent crimes, like homicides, for instance. When you look at property crime, again, it looks quite similar, where, you know, individuals that drop out of the formal sector are actually more likely to be involved in enterprise-related property crime. With drug crimes, actually, there's not much of a statistical difference at the cutoff. So there's not much of a change around the cutoff. And, you know, in the interest of time, I'm not showing you the results for the non-enterprise related crimes, but there's actually no detectable change at the cutoff in crimes of impulse or passion. The other kind of thing we try and understand is that, are these effects different by the type of neighborhood you live in, right? The city is actually quite a segregated city, where a lot of the gang activity is, you know, in the northeast and the west and the east and the kind of the extremities, whereas a lot of the formal sector employment happens around downtown. So is it that if I live in a gang neighborhood, is it more easy for me to kind of switch out of the formal sector and get involved in these criminal enterprises? And the answer is, we do find that at least for certain types of crime, these effects that we pick up are actually a lot stronger in gang neighborhoods than they are in non-gang neighborhoods, right? So what are we doing in this paper? We're really trying to estimate this kind of occupational choice, this career decision at the individual level, right? And from a crime policy point of view, there's this idea that more policing or deterrence might have a limited amount of efficacy in a context like this, if, for instance, the youth are really being disincentivized away from formal sexual work, right? So at vulnerable ages, when these youth are 16 or 18 years old, if they're not being encouraged to join the formal sector labor market, they make a decision to get involved in these criminal enterprises, and that can really change the trajectory of their lives, but they're kind of stuck in these criminal careers, right? So trying to incentivize these youth to get involved in the formal sector can be quite an effective strategy in trying to keep them away from these criminal enterprises. More specifically, for a policy like this, this kind of policy that we are studying is actually quite common in other parts of Latin America and even other low and middle income countries, where they have these kind of informality clauses, where they say that you'll only get these benefits if you're not in the formal sector. But these kind of informality clauses can lead to these kind of perverse outcomes. You could still target these benefits to low-income households without requiring them to drop out of the formal sector. If you take away this informality clause, you can have this added benefit of really kind of discouraging youth to get involved in these criminal enterprises. I'm going to stop here. Thank you very much.
Thank you. And wrapping up both today and the series is Sarah Heller. Sarah, the floor is yours.
Thank you very much. Thanks again to Jen and the Niskanen Center and everyone who has gone before me with very interesting presentations. Thanks. So if you've been paying attention throughout this whole webinar series, you may remember that you've heard about summer youth employment programs, or SYEPs, twice before. But just in case you were distracted by your email during those other sessions, I'm going to start with a sort of brief reminder about what an SYEP is before I get to the sort of new content. So almost all of the 30 largest cities run some kind of SYEP, and a lot of the mid-sized cities as well. They typically last between 6 to 8 weeks, often serving ages 14 to 21, although there's some variation on both the top and the bottom end across the country. And as the name suggests, the core programming element is a job. So most often they involve government or nonprofit work, like urban renewal projects, being camp counselors, working in government offices. But a lot of the programs also place youth in healthcare, retail, and other private sector positions. The nonprofit agencies that actually implement the program locally often include some other program elements. So it's a little more structured as a youth development program than if you just went out and got your own job over the summer. Now, there's never enough funding to serve every young person who could potentially benefit. And so a lot of cities use random lotteries as a way to fairly allocate a limited number of slots. So that helps to ensure that everyone has equal access to the opportunity. And it also sets researchers up to be able to rigorously estimate the effects of the program by comparing the group that gets offered the slot, or the treatment group, with the group that doesn't, or the control group. And we can track both sets of youth in administrative data, compare their outcomes, and know that that's the effect of the program itself. So what you've seen in the past is that in New York, researchers found the SYEP there decreased incarceration by 10%, decreased mortality by almost 20%, which they think is driven largely from a reduction in homicide. In Boston, it's a slightly different set of outcomes, but similar message, big declines in charges for violent and property crime. So in addition to these two studies, which you've seen presented before in this series, I have prior work studying a program called One Summer Chicago Plus across a couple of different years. In 2012, I found a 42% decline in violent crime arrests in the year after the program. And in 2013, I repeated the study, but with a new cohort that involved much more criminally active youth, finding a similar decline in violent crime arrests of about a third. So that's already a lot of evidence about SYEPs, but wait, there's more. So in this third study, which is my emphasis today, I had two more pieces of evidence. In the first, I look again at the Chicago program, but this time as it's scaled up, basically tripling its initial size. And what I found is, again, a large reduction in arrests. So this time it was more concentrated on drug and other arrests, but that's likely partly, at least partly, because 2015 had historically low violent crime rates. And so there wasn't really that much room to fall in terms of violence that year. And then the last study was a Philadelphia's program, which they call Work Ready. And this one operates at scale across the whole city. And there too, I found similar drops in all arrests and in juvenile incarceration. Now, of course, these are all slightly different outcomes. They cover slightly different time periods, although in almost all of the cases, the declines continue after the program ends, right? So it's not just a question of keeping youth busy over the summer, but rather they're taking something with them that changes their future behavior. Still, across all of these studies, they're not exactly comparable, but if you look at this set of evidence, everything on your screen together, it tells a really consistent story, which is that SYEPs reduce violence and criminal justice contact. And this is maybe a little bit surprising because a lot of other programs have had trouble replicating effects in new settings, right? So you try something in one place, it doesn't work as well in another. And so it's natural to ask why the effects are so consistent across time and scale and context. And so part of the explanation seems to be that unlike a lot of other education and youth development programming, where it seems like the devil is really in the details, with SYEPs, it looks like it doesn't matter all that much when you vary the program structure or who's implementing the program. And there's kind of two pieces of evidence for this claim. The first comes from looking at treatment effects across the different local agencies within a city that implement the program. And these agencies have a lot of variation in who the staff are, how much experience they have, how big the organization is, how it works out the matching between youth and jobs, all sorts of implementation decisions. And in Chicago and part of Philadelphia, youth didn't choose their local provider, they were placed there by lottery. And so we can actually test whether treatment effects vary across the different providers. And the answer is that they don't. There's no significant variation in treatment effects across providers, which suggests that it's the basic approach of the program that matters, not the staffing or the organizational capacity or the sort of details of the professional development that's offered. The second piece of evidence is that we've tested different versions of the program. So some with and without social emotional learning, some with and without a separate adult mentor and civics curriculum. And I'll say these results are a little bit less clear. I think there's some indication that the extra training and support does help increase the program's impact, but the differences are kind of hard to detect in the data. And in fact, places like New York don't have those extra pieces, but still reduce crime and violence. And so at a minimum, it doesn't seem like these elements are central to the program's success, even if there's some possibility that they help magnify effects. So it seems like on the program side, SYEPs are sort of unusually replicable and scalable, at least within the big cities that have tried them, that have the infrastructure to implement them, all of which are operating programs with a lot of planning and care, right? I don't mean to say implementation quality doesn't matter at all, just the variation that we see in practice doesn't seem to matter. But, and this is sort of a key but here, who you serve does matter. So you sometimes hear policy discussions about how some youth are too far gone or it's too late to change their criminal behavior. And I think that may be true for some interventions, but here, as it turns out, it's actually the young people at the highest risk of negative outcomes like violence and other crime that have the biggest declines in response to program participation. And so I'm going to show you this kind of visually in a graph. So each dot here is a program effect for a particular group and outcome. The blue dots are Philly's Work Ready program. The red triangles are Chicago's 2015 One Summer Plus program. And the outcomes are anything that the program significantly affected. So different types of crime, incarceration, and so forth. Along the x-axis, the horizontal axis, I'm showing the average outcome. So the amount of crime or the amount of incarceration for the control group. In other words, the sort of level of risk of these outcomes in the absence of the program. So the fact that the blue dots are on the left and the red triangles are on the right indicates that the young people who applied to Chicago's program were generally more involved in crime than those who applied to Philly's program. And in fact, that makes sense because Philadelphia's program has universal eligibility across the city, while Chicago's is purposefully targeted to those at higher risk of violence. And so we can sort of see here that that targeting is working. But the really crucial pattern is what happens on the y-axis, the vertical axis, which shows the program effect. So what you see as you move left to right is that as the risk of negative outcomes gets bigger, the program effects also get bigger. They get more negative, bigger decreases in crime. And in fact, that relationship is basically linear. You can kind of draw a line through it. Higher risk corresponds to consistently bigger program effects. Now, what I'm showing you here is just the main significant effects for the two new experiments that I mentioned from this paper. Now let me add all of the significant main effects for all of the other studies, that I showed you before. And you see that the effects basically all lie along the same line. It's a really consistent pattern. Now you also sort of see the mirror image across the axis of that pattern for the two adverse effects there, the green diamonds, which are some longer term increases in property crime in Chicago. Those show up within the subgroup of youth whose employment actually benefits. So on average, these programs don't actually help employment. There's some group that actually does see an increase in employment, and the property crime increase is concentrated among that group, suggesting that maybe what's going on is that these youth are traveling to richer neighborhoods for work where there's more stuff to steal. But everything that's below the zero line there is much more socially costly. So declines in violence, incarceration, mortality, that all sort of has this consistent pattern in terms of risk and responsiveness. And we see that hold up even when we break things down even further by subgroup. So here I now have a separate marker for different types of individuals across papers. So some of these are boys with and without criminal histories, all sorts of different divisions that these papers report. And we see here the same linear effect, right? There doesn't even seem to be any leveling off really. It's just a proportional increase in program effects as risk goes up. And that sort of pattern of proportionally increasing program effects has important implications for targeting and scaling, right? So for policymakers, it's worth thinking carefully about how you set your eligibility criteria, as well as what this means for how big your program can feasibly get. So for example, if you're already serving all of the crime-prone young people in your city, expanding to serve additional youth might mean serving youth at almost no risk of crime. Now that might have other benefits, right? You might sort of want to generate income transfers for that group, but it's not going to have much of a crime benefit. Conversely, if you're serving young people at relatively low risk of violence, but you want to be reducing violence, those people might respond, right? Everyone is sort of lying underneath the zero line there. But you might get more bang for your buck from adjusting who your program serves, even without changing the scale, right? Just sort of adjusting the targeting. Now, of course, this targeting recommendation has caveats, right? It might be harder and more expensive to recruit and serve criminally involved youth. And you probably need to find local providers who know how to do it successfully. It's not always an easy task. It's also possible that peer composition is an important part of how the program works, right? And if so, making really massive shifts where the whole population changes might have unintended consequences. Although I'll say we've tested it in Chicago with a population that's about half from the criminal justice system and half not. And so that's a lot more criminal involvement than in most cities. So there's a lot of room to move relative to what most cities are serving. And then lastly, it's worth noting this higher risk group, that if you sort of shift this targeting to a higher risk group, that's different than the group I mentioned that benefits on employment, right? So the group that benefits on employment tends to be less involved with the criminal justice system, more engaged with school, younger, potentially more female and Hispanic. And so there's a trade-off that requires a decision there, right? You have to choose as a policymaker what outcome you really want to target, and then make your eligibility choices accordingly. Okay, so to wrap up, it's pretty rare to find results that are this robust across settings. And I think it's especially promising that the people who are the worst off are those helped the most, right? Because that means we can spend public dollars efficiently while also promoting equity. Now, of course, SYEPs serve a limited group of people, right? They're for high school kids during the summer generally, and it's not entirely clear how lasting their effects are. And so this is not the only solution we should be looking for. We should keep pursuing a whole range of ways to reduce violence. But as we do, I think this is a useful frame to think about sort of which approaches can we find that are replicable, that are scalable, and that can help generate cost-effective change. Thanks a lot.
Thank you, Sarah. An excellent and fitting note to end on. Thank you to all the presenters today. Thanks to everyone who's presented in other sessions of this webinar series. And thank you very much to the Niskanen Center for hosting us. You can find videos of all of these webinar hours on their website. And of course, you should follow Niskanen if you're interested in this kind of content. They're doing lots of cool stuff in the crime and the criminal justice policy space. Thanks again, everybody, and enjoy the little bit that's left of your summer. Have a great day.